we initially have that decrease in temperature, is a leftward shift of the oxyhemoglobin dissociation curve. And really, in terms of symptomology, you're not going to see too much related to that. You might see the patient's respirate slightly decrease, or you may see it slightly increase as they have increased catecholamine release. So the body's recognizing that there's something bad going on here, or I'm having decreased oxygen delivered to the peripheries. We're releasing catecholamines, and we keep our respiratory rate around normal. So in terms of our early stage of hypothermia, usually we don't see a ton of respiratory changes. So maybe a slight decrease or normal respiratory rate. So slight decrease or normal respiratory rate. So that's the first thing that's happening. It's like we said, as we get cooler, the initial shift is to the left. But as we kind of continue through this, the problem is that we're going to have lots of kind of bad shit developing in the lungs. So one of the things that happens as we start moving towards a moderate hypothermia, we start to paralyze our cilia. And why would that have a negative effect on the patient? Right, so I can't filter, and what else can I get out of my lungs? Yeah, so in the moderate stages of hypothermia, I start to see cilia paralysis, or the cilia starts malfunctioning. Right, I have impairment of my mucociliary elevator system. So that is ciliary impairment, which leads to an increase in mucus in the lungs. So if you think about it, as this patient's progressing towards CNS depression, what's going to happen to their respiratory rate? So yeah, the signals from the brain are ceasing, right? Or the brain's stopping its function, or it's not functioning as it should. So one of the things that happens is we have decreased CNS innervation, which eventually is going to lead to decreased respiratory rate. So as the patient enters into this moderate stage of hypothermia, that's some of the things that we start to see happening. We start to have increased crackles in the lungs. And we start to see a decreasing respiratory rate.
Why the crackles?
So the crackles are the inability to clear that mucus. So as my cilia stops working appropriately, I can't get that mucus, or I can't have it shift out of my lungs. So I start losing the ability to actually get it out or cough it out. So you can get kind of coarse crackles developing in that patient's lungs. So as we progress into the further stages of hypothermia, what happens is if I'm decreasing my respiratory rate and I have CNS depression, it's going to happen to the ability to clear acids and CO2. So it's decreasing. So the patient actually, in the late stage, becomes very acidotic. So I stop delivering the right amount of oxygen to my periphery. Remember, I've shut down my blood flow there, right? I've had peripheral vasoconstriction to try and retain that pee. So the cells of the periphery start to become very acidotic, or they're not getting the oxygen they need, so they need to start performing lactic acidosis. So as we start entering the late stages, this patient becomes severely acidotic. We know that acidosis does what to our brain? Yeah. Right. It causes CNS depression. So this just impacts that CNS depression that was already happening, and our respiratory rate can drop further. So what happens is we usually see a rightward shift in the oxyhemoglobin dissociation curve as we enter a late stage of hypothermia. And the problems associated with that are that we're just much, much more acidotic. So this patient's respiratory rate, we have a drastic decrease in respiratory rate to the point of apnea. And really that's the progression we're looking for, right? So slightly decreased or normal respiratory rate, a drop in respiratory rate, and then the patient is in a life-threatening bradykardia or apnea. The last thing that we see in this late stage of hypothermia in terms of the lungs is as we become more acidotic, we start to see dilation of the constriction constriction of the pulmonary vessels. So I start constricting the pulmonary vessel, what's going to happen to pressure in it? It's increase or decrease? Goes up. So I see an increase in pressure in the pulmonary vessel. Problem is, really cold environment stimulates my parasympathetic or my sympathetic nervous system and dilates my bronchioles. So cold environment dilates the bronchioles, and the acidosis constricts the pulmonary capillaries. So I have an increase in pressure in the pulmonary capillaries because they're vasoconstricted. If I have dilation of my bronchioles, I have increased or decreased pressure in that bronchiole. A decrease. So where is fluid going to be able to shift? Into the bronchiole. So this is where you get what they call a viscous bronchorrhea, or we get a non-cardiogenic pulmonary edema for these patients. You might hear, again, just crackles in the lungs. So again, in terms of recall or testing, you won't have to know that what's happening exactly in the lung or the bronchiole. What you'll have to know is that in the late stage of hypothermia, you're likely to see coarse crackles as fluid shifts into the lungs. So decrease in respiratory, apnea, and then crackles. Part of the problem associated with this person's at risk of that ARDS that we talked about. So as they become more and more acidotic, what happens is they start to see breakdown of the pulmonary vasculature, breakdown of the alveoli, and even if they survive the initial hypothermic event, because their lungs have started to basically be destroyed by the acidosis, they might simply die from that adult respiratory distress syndrome, or that fibrotic destruction of the lungs from the severe acidosis. So that makes sense. Those are kind of our respiratory changes. The big ones really are that the respiratory rate decreases, if we had to put it into a cold stone. So as the person gets cooler, they become more acidotic, CNS suppression, respiratory rate just slowly continues to go down. We know we're likely to see some crackles in their lungs because their cilia doesn't work, and because they have fluid shifting from the acidosis. Any questions about that? So what's happening in the heart during this time?